Welcome back, welcome back. You are still tuned into Funtastic Fridays here on News Talk 93 FM. And you know, we're here with you every Friday. And all the Friday, them when a name Friday, don't ask me no question because I don't have the answer. From 5 p.m. to 8 p.m. And we're in the segment called Talk the Ting with Kim, where we're basically discussing diabetes. You know, it's diabetes explained. So as I said, we're not doing the whole sugar, you know, just diabetes is sugar. We don't really understand what it is. We're going into the information, and we don't know how we don't like reading us, so make sure we bring the experts too, you know, so they can listen to it. And I hope this inspires you to do some research on your own, ask some questions. You know, there are persons that they have the information, they're willing to share it, but no, we not ask.
I want to very much thank Mr. Alex Johnson.
Yeah.
Yesterday, Dietician and MPH students. So we
went into what diabetes is. We spoke about type 1 versus type 2. We spoke about the importance of exercise, because that is, in so many areas of our life, exercise is just essential. We touched on sleep a little bit because we did a whole segment on that too, that sleep is important. The body needs it as well, right? So now what I want to go more into is to, you know, we hear all these things about what we should do and shouldn't do, but I want some statistics, you know, like you said on the ward today, you know, easily 4 patients right there, and then being type 2 diabetes, like how often, I know the government did a whole thing of NCDs, non-communicable diseases, and diabetes is the top one. So can you share some statistics regarding what we're experiencing, whether worldwide or in Jamaica alone? Any one of the two?
Yes, so in Jamaica, currently from our Jamaica Health and Lifestyle Survey in 2016 and 2017, and I know this may sound far, but it is so relevant now. So we see where it is already declared that we have been in the middle of an epidemic of this metabolic disease. So it is responsible for a heavy burden of our chronic illnesses, long-term disabilities, and premature loss of life throughout the Caribbean. So in 2016, 2,339 persons died from diabetes in Jamaica, accounting for 12.7% of all deaths. As a cause of death, it ranks third for men, and for women, it's the first for women with 1,373, and for the men, 966 deaths. So,
that's serious. And that was in 2016, you said?
Yes.
So, and guys, you know,
just like
we usually get worse.
So
if that's the case, if those are the numbers back then, and that is what almost 8 years ago, basically, going on to 9, you can imagine the numbers now.
And now, in the most recent research done by the International Diabetes Federation, the IDF, Jamaica is one of the 23 countries of the IDF region. So Jamaica is involved in the International Diabetes Federation. But in the world currently, 537 million people have diabetes in the world. Yes. And currently in Jamaica, we have 231,000 cases of diabetes. So it is crazy.
Serious.
To what, and this is in 2021.
Yeah.
I know that there has been some changes, not very far from that, but we are seeing where diabetes is a big deal. And you know the funny thing about it, a whole heap of people don't know that they have diabetes. So yes, because some persons have not yet tested. Some persons are not willing to be screened. You know, you have some people tell us they have a dead anyway. So we are seeing also where it's not just death from diabetes, but earlier I would speak from the Jamaica Health and Lifestyle Survey, and I know for the Ministry of Health they have been pushing this because persons are losing their limbs. And the same thing when we talked about the cut earlier, Mr. Lionel,
I check him
just to make sure some persons they get the cuts because now they're losing sensation. There's nerve damage.
So they don't feel
they don't feel what's happening, and some of them they have lost their sight even. You see how many disciplines now, how many parts of the body
It's affected.
is affecting. So that's why at our health fair we're going to be good. We're not doing any eye screen, unfortunately, but we're mainly focusing on the oral health also is a part that people don't know. Big up to all the dentists in the class.
Yes.
Big up Dr. Michelle, Dr. Dwight. We have a twin dentist in our class.
Nice.
Yes. So we have Dwight and Dwayne, and we also have Dr. Andrew Phillips. So we have a few dentists in our class, and they are going to be leading the charge on the day about the importance of oral health, because yes, diabetes is one, but the whole heap of sugars that you're eating is causing dental caries, rotten teeth. Yeah,
I've been told that the dental care, so if your mouth is not healthy,
it's a gateway to everything else.
That's right. That's right.
That's not healthy as well.
So if you wanna hear more about that, I'm not a dentist and I don't believe in crossing over my scope. But just general knowledge. We all as clinicians have general information, and oral health is very important. But when we're talking about oral health and diabetes, I won't even let the cat out the bag. When you come on next week, Thursday, you will hear more about that in terms of oral health, and that's something that I even want to benefit from, because it is serious. We want to know what's going on in our mouth as much as we know what's going on in our bodies,
and how it affects the rest of us, what's happening in our bodies.
That's right.
But what I want to go into now, because I know your area of expertise, also your personal business, diet, basically. You're a dietitian, diet. What are some of the things that you would say we need to avoid? Because I know you say you're not going to win not to eat certain things, but reality is there are some things we should just not be consuming.
I mean, what not to prey on, what overkill.
Yes.
What cannot be
What are some of the things?
So what we recommend generally, so let me just put it out there. There is no such thing as a diabetes diet. We don't have no diabetic diet. So like, for example, we have low salt diet for hypertensive, stuff like that. For diabetes, you can eat everything, but we're talking portions. So a big thing with diabetes nutritional management is portion control. So you know that, and I'm glad you asked this question. Some people think we know, all of us know that fruits are healthy. It's good for you, but you know that as a diabetic, food can be your nail in your coffin. Yes. So our body doesn't have any special detector for different types of sugar. So when we eat our fruits, which you get fructose from our fruits, we are seeing where persons are eating 1 dozen mango. Yes, so mango time, we wash out with pot and we turn it down and we sit down with the basin and we eat the dozen East Indian or the Julie mango.
Which is good healthier
because big up to the Julie mango lovers out there. But we eat all these mangoes, all a dozen mango, and then you come to clinic and you tell the nurse,
eat healthy.
May I eat healthy and fruits, may I eat. And you say, doctor, I've been on a healthy pathway. And I didn't eat nothing that day, I just ate fruits for the entire day. And when we investigate, eat 2 dozen mango, like the mango going out of style. So what we are seeing is that persons are thinking that, okay, these things are deemed healthy, but I'm just going to eat away. So what we are looking at is portion control. And we also encourage our diabetics to stay away from simple sugars, simple carbohydrates, and eat more complex carbohydrates. So our simple carbs is more processed, refined carbs. So like our refined flours, or refined cornmeal, or everything is refined. So we see our rice, refined rice, the white rice and all of that. We see where it goes through process to break down some of the grains, break down some of the wheat fibers, and it causes the thing to, the starch to be used up by the body much quicker. Because it enters the body, it breaks down quicker and it goes straight into the bloodstream. But with our complex carbs like our yam, or dashin, or cocoa, or ground provision, anything that grow in the ground and on the tree, or planting, or breadfruit, we see where these are more complex carbohydrates and they take a longer time to break down in our bodies, and our bodies get some more time to break down these sugars into smaller portions, so it's easier for your body to manage it. We're not saying you must go eat out one whole pound I am now.
Yeah.
But as I said, everything must be in portions.
Moderation.
Proper portion, proper moderation.
So if you're looking at food options here, as I said, try to get towards process.
Yes.
I mean, the more
complex carbs.
Natural. This processed food.
Yes. And I know I'm not here to bash rice. And rice has gotten a
I wanted to talk about rice and bread.
Proper beat.
Don't
even start.
But every time everybody talk about diet, the first thing is, boy, I'm gonna cut out rice, boy, I'm gonna cut out bread. And I'm like, why these two particular things? So that's, you see my mind. That was the next area I wanted to go.
Rice and bread, probably getting everybody daily diet. For most bread. So we might see that as an easy name to call, but
how does that affect us?
So we have what we call our glycemic index, and this is just a grade to say how high up in terms of the amount of sugar content is in the foods. So we tend to see where our white breads are on more higher glycemic index, but in Jamaica, what them call brown bread really.
Really brown bread. It just color brown.
Bread with some hint to it. So real brown bread, you have to put it in the fridge. And I just want us to know, let's burst that myth from now. So what we're getting for brown bread is really fortified white bread. So what I tell persons, for example, for breakfast, you're allowed at least 3 servings of staples. So you eating a slice of bread, a finger of banana, or 2 slices of bread, and here you're making a sandwich. So you have your 2 slices of bread, and you have your maybe your eggs with that. We're not talking about 6 eggs now. We're talking about 1 or 2 eggs. And we usually recommend, especially for our diabetic patients, to watch the fat intake also, because there is some biochemical stuff that's going on that we have to also watch our fat content, because Mr. Cholesterol is close behind, waiting on a door to open to jump right on in. So we need to watch what we are doing in terms of our fat intake also. So for our diabetics, we just recommend a holistic diet. There is a bit of research now on the Mediterranean diet, and we are looking on introducing more grains, whole grains, as I was talking about earlier, oats, those stuff like that. And we want to look more on the whole grains and more on your fruits and vegetables, less processed foods. But as I always say to patients, you are not a dietitian, you're not a doctor, you're not a dentist. You don't need to figure these out on your own. It's good to see the practitioner. That's why we go to school, that's why we study. I won't, if I have a toothache, I'm going to link up Andrew, I'm going to link up Michelle or Dwight and Dwayne and get my stuff sorted out. Or if I'm having a medical issue, I call Kachel. I'm not going to figure it out on my own. So what we need to do is stop turning to Mr. Google and Mr. Instagram to solve our problems. And as far as Mr. TikTok, people using TikTok to diagnose themselves. That's crazy. But we want you to go and get proper testing, proper screening if there's a challenge. So now we're talking about diet. You want to change your diet, see a dietitian. You don't have to see me. You can go to your public system, public clinics. You do have nutritionists in the health centers and in the clinics, and you can go to your private doctor, get a referral. You can go and see your dietitian and get checked up, get guidance in terms of what is best for you, because what is good for Kim is not good for me, and what is good for Lionel is not good for me. And even though me and Lionel are males, we are not the same. It's not the same. It's not the same, because everybody diet, medical nutritional therapy is individualized. So I can't have his prescription and I can't have your prescription. So our diet prescriptions must be individual. Our bodies require different things. We have different basal metabolic rates. We have different energy expenditure. I may do more physical activity than you. You may do more than me. So when you come to your dietitian, all of these things are factored in. So we're not just telling you to go eat fruits and vegetables, but we are calculating everything that fits you. So your diet prescription will now fit you and fit what you need. And let me just put this out there for the listener. When somebody come to you and they are not a dietitian, and there are some people that are in our gyms parading as dietitians, they are not, and it's serious. We have seen persons get hurt from these persons because they are prescribing too much protein for the persons, and I use the word prescribing purposefully because nutrition, food should be prescribed. It's medicine. Hippocrates said, let your food be your medicine, your medicine be your food. So if food is no medicine, it must be portionized, it must be in a dosage. So we have seen where persons have taken in too much protein and damaged their kidneys. It's that serious. You can get hurt from eating too much of certain things. So we recommend for persons to take this serious, get the right persons in play. You know, we even see where people taking on some persons who are not trained doing dental procedures and stuff like that. So our space is highly perverted. And this is a whole other discussion. We won't go into that because Brother Alex is going to get worked up. But we just want to understand that we are to find the right persons. We are educated people, especially for our university students. We don't need to be following these persons. We are being trained to think higher, and we recommend that you see the right person. So I'm having a mental health issue. I'm not going to go to some guru. I'm going to find my psychiatrist or my psychologist. Big up Nemi. Yeah, and we're going to go and get the proper information. Big up Brian too. We have 2 psychiatrists in our class, so I have to big them up. Yeah, so we have to get the right person for the job. I won't go to my barber for dental issues. Yeah, you know, the barber make me get up and look like smarty. You know. So as we go forward in empowering global health in our diabetes awareness for this entire month, we want persons to be empowered to find the right services also.
But you see, when you're talking about the right services, one of the things that came to mind is the fact that I don't think dietitians are really seen as, you know, everybody say, oh, find a doctor, find a dentist, find a... We don't really think about dietitians. So even to tell persons to go to dietitians, that's never been even with me who try to eat better, it's never crossed my mind to say, find one. It's go and go read up and find out, because it's not taught that dietitians are important in the health field. But we're learning now that you have to go to the specialist.
Yes, you do.
We don't really think about is that, as I say, we're not even in the space to see that.
What
to do is that word.
We never go doctor. I was supposed to go doctor.
Go to the clinic.
And that is why I correct my patients. Not that I'm offended by the title, but what I want for them to understand is that there are different clinicians. So somebody may come to your bedside, they're your physiotherapist. Somebody may come to your bedside, they're your clinical psychologist. Somebody may come to your bedside and this person is a speech and language pathologist. So medicine is one big thing, but it's wide, it's open. And when you go to other countries, first world countries, you see a little bit different approach to how they interact with the different clinical specialties. But we have to understand that if we're in a space, that's why I'm here today, not just to speak about our World Diabetes activity, but it is about education, empowering persons, and advocacy. Because if people, I'm sure some persons here tonight have learned a whole new world.
Not even some.
My question here, though, because one of the trends that Jamaicans tend to take is, you know, as soon as you see somebody putting on a lot of weight and everything, say, watch out for diabetes.
Yes.
So what about slim persons? So them say,
So my friend, let me tell you something. It's a problem that we have in terms of body image. Now, anybody tell about your weight, ask them if they are a dietitian. Tell them, say, me see so. Because, let me tell you now, body weight is relative, and I'm going to break it down real deep. I'm going to smash some people right now who like to trouble people about their weight. I am the only, me and all the other dietitians into Jamaica, we are allowed to trouble people about their weight in the context of the trend. Yes, but what I'm saying now, when you look at somebody, you're looking at them from your general perspective. But when I look at a patient, I'm looking at Kim here now. I'm not looking at Kim as Kim being big in body, but I'm looking at Kim from a perspective that Kim has fat mass and fat-free mass. When you go on a scale, you're getting everything. So if you weigh 200 pounds, you're getting the 200 pounds on the scale. But that does not mean 200 pounds of fat mass. So what we do now as dietitians, we have in a part of our assessment, we call it anthropometry. where we go in depth in assessing a patient's body composition. So now what you will get this at the health fair too. We're not just talking about body weight, but we're talking about body composition. So you may see a bodybuilder with a BMI of 40. And 40 means class 3 obesity, morbid obesity. But this person, when I see them, I see somebody with a high muscle mass. So we have to take away this content. So don't get me wrong, if you're obese, you're obese. And there's no going around that. But now we're looking at not just weight, like somebody being fat or fluffy or slim, but we're looking at persons from their body composition. And as I say to my patients, be the best version of your body type. So some persons will never be skinny, and it's okay, and some persons will never be fat because genetically that's not their makeup, that's not their body type. But if you find out when you come to your dietitian, I'm tired to say this, when you come to your dietitian and learn about your body type, you will understand the importance of understanding your body type, the importance of your body type, and knowing how to be the best version of that body type. So this again, social media has perverted what body types look like. So you must be very muscular for men, and you must be very slim for women, and have a fine waist
and what waist? What waist? That's what they say.
Yes. So what we want to recommend, and we're begging for persons to understand that weight is relative. So yes, we're not telling people to get big and fat and then say the dietitian pan New Star 93 FM said all of it does big and go on. So but I'm saying that we need to understand now that when we're talking about clinical weight now, we're not talking about just weight to go up on scale. We're talking now about your body composition. We can have a skinny person who is diabetic and at high risk of diabetes. So what we want for persons to understand, and then there's again even different types of fat where the fat is the adiposities are being shown. So we have persons with high visceral fat, and when you do the body analysis, when the electricity runs through your body, it picks up the visceral fat. Visceral fat is the fat that surrounds our organs. Some of us are skinny, but we have high visceral fat values. That's not good. No, it's not good because that's fat around your organs. But then we have persons who have a high level of subcutaneous fat but low visceral fat. So we want to push this mindset away from, I have to be slim and fine and mager, and I'm using that purposefully to be healthy. But you have fluffy women who are healthy.
Very healthy.
You have bigger body men who are healthy, and it's just genetically their body type. So what I want for persons to do is to not be okay with being fat, but be okay with being the best version of their body type. And that means that they're going to exercise, they're going to keep fit with the weight, because some persons will never get skin. We have some hormonal issues, we have some metabolic syndromes that will cause them, like PCOS and stuff like that will affect the weight of a woman, or for men you will have some different problems, genetics and stuff like that. But we want to push away the ideology that you have to be slim to be healthy.
Listen.
One final note here. So someone sent in, eat the rainbows and in moderation.
That's right. I love to use that one. You want to ensure that your plate is colorful. Colorful, not the Skittles. No.
I'm going to say, they not have a cheese and Doritos.
But I'm talking about if we are doing a fruit salad, we want to have green, want to have red, want to have purple, all sorts of colors popping at us.
Just white rice.
No. And the different colors do different colors mean different vitamins, different minerals. So you're getting an array of vitamins and minerals. All
right. Well, listen, that was a wealth of information that I'm so grateful for. A plate full of information, and it was very colorful. I can tell you that much, right? But if you want to know more, I tell you guys, November 14th. That's next week, Thursday, from 9 a.m. to 3 p.m. on the UA Mona campus. Where exactly on the campus is that?
So it's at the Undercroft at the Medical Science Building. And before we go in, I just want to big up some key stakeholders. So not everybody in our class are clinicians, but we have Auntie Uki. She's the mommy of the class. She makes sure I take care of everybody. So I want to big her up also. And I want to big up all the persons in our MPH 2024-2025 batch. Big up yourself. Me call holy name. Me never call some people name. I want to big up all the nurses who have been doing the screening. So big up Nurse Marion, Public Health Nurse Marion. And we have Public Health Nurse Christine, smart guy. And we have Sister Noreen Roberts. Big, when you name sister, you're a senior nurse. So we have some strong nurses in our class. We have several different personnel who will be there on the day helping to screen and to check.
Alright. Well, we're very appreciative. So thank you for being here, Alex Johnson. Let me tell you, you'll be back. Because we have more to talk about, right?
We are coming back.
We are coming back.
Big up to all our guests on the show today. Shout out to Miss Snow. Everybody who's been a part. Hope you guys have a fantastic week.
Be safe. Take care of yourself until we soon again.
News Talk 93 FM. Everywhere.